Exam is around the corner, and whether it's your council exam or your normal OSCE exams in your school, these are the following things you should do, even if you are blank in the exam hall or you don't know what to do. Welcome back. So you go into an exam hall, your OSCE exam hall, whether it's your professional exam or your school exam, OSCE exam, and you don't know what to do, you are blank. These are the following things you should do to ensure that you don't leave there with a 0 as your score. Now, the first thing you do is to greet your examiner or your supervisor. Sometimes these things have marks, but you don't know. Greet your examiner and introduce yourself. After doing that, the next thing you should do is to read the question out loud and clear. Don't murmur it. Read it to both her hearing and both your hearing too. Now, you've done this. The next step is to do what? Obtain consent. Now, all nursing procedures, you have to obtain consent. So that's just like a bonus. Obtain consent, no matter what the procedure is. After obtaining consent, you gather your materials. You just say, I gather my necessary materials. Look at the materials that you have on your tray. You mention some of them if you can. I gather my necessary materials. I gather my screen, mention them. There are marks for these things. The next thing to do is to place patients in a comfortable position. All nursing procedures have positions that you are meant to place your patient in. So you have to ensure that you say it. Although sometimes these positions are like stated, whether it's high Fowler, Sims position, so many positions we have in nursing. But if you don't have an idea of any position or the position that is meant for that procedure, my dear, go ahead and say, I place patients in a comfortable position for the procedure. The next thing you will do is to screen your patients. Ensure privacy. Do you understand? Ensure privacy. Most of these procedures, although some of these procedures might not necessarily need privacy, but then you should be smart. You should know procedures that will need privacy. For example, checking of vital signs and all that does not need privacy. Do you understand? But then these procedures that are exposed and you're supposed to know procedures that will need privacy. You tell them, I screen my patient. You've gotten mark for that. You wash your hand and you don your gloves. These two things are very, very important. It has marks. Washing of hands, donning your gloves, your PPE. You see aprons. Like if you use your eyes, sometimes they will bring out these things. You see aprons, you see some PPEs. You wear them. Wear your aprons, wear your gloves, and your nose masks if there is anyone available there. Just make use of your PPE, wash your hand, don your gloves. All these things carries marks. After this, when you're done with the procedure, doff your gloves, wash your hands, clear your workspace, then place patients in a comfortable position. After placing patients in a comfortable position, make sure you document. Make sure you document what your findings, you document. And the last thing people forget to do is to thank patients or praise patients for complying and cooperation. So after doing all these things, trust me, you're going to leave there with nothing less than 5 marks, and which is better than going there and not doing anything and standing there and just leaving without a mark. So we've come to the end of today's session, and I believe I've been able to give you ideas on what to do whenever you find yourself in a situation in an OSCE setting and you don't know what to do or you don't know the procedure. I believe if you do these things, you'll be able to get marks, even if it's not all, but at least it's something. So thank you so much for listening, and I would love to see you in my next video. Stay tuned and bye.